Hi, I'm Nikki Rosette. I'm one of the pediatric pharmacists here at Carilion Clinic. During my time at Carilion, I've been fortunate to work with many departments, including the Antimicrobial Stewardship team. While I'm passionate about stewardship professionally, my interest in acute otitis media actually stems from a more personal place. My youngest daughter had recurrent acute otitis media, and through our many courses of antibiotics, some of which maybe weren't prescribed optimally, I realized there was some opportunity for improvements. Lucky for me, my children's PCP was Dr. Chris Pierce. During one of our many appointments with Dr. Pierce, we started talking about opportunities for stewardship in the outpatient environment, and through these conversations, an idea was sparked to study our current practice related to acute otitis media to see where the holes were, how we could best improve care for children in our community. And so was born our project team of outpatient providers and pediatric and ID pharmacists. I want to give a big shout out here to Dr. Lauren Freeman, one of our former pharmacy ID residents. She took the lead on this project and the subsequent resource development and did a wonderful job. We evaluated a snapshot of acute otitis media prescribing practices at all 3 outpatient PEDS offices with the goal of identifying those potential gaps to target stewardship initiatives. This retrospective cross-sectional review included 168 patients between July of 2018 and July of 2019. As expected, their median age was about 3 to 4 years, and most patients presented with URI symptoms. With the results of our study, we found 3 key takeaways. 1, our prescribing rate was very high. Of the 168 patients reviewed, 167 had a prescription written. Second, we likely had missed opportunities for delayed prescribing. Of course, with a retrospective review, we weren't able to capture all of the conversations that occurred with parents or caregivers recommending delaying therapy unless XYZ, but there were 64% of patients deemed eligible for delayed prescribing in this time period, and only 1% had documented utilization of this strategy. The third takeaway was related to duration of therapy. Nearly all patients in this group had a duration of therapy of 10 days. So utilizing those general recommendations based on age and severity of infection, there were many patients that could have qualified for a shortened duration of therapy of 5 or 7 days, decreasing overall antibiotic exposure. So to target these 3 main identified opportunities for improvement, our work group developed 2 tools to assist frontline providers. First, we'll review an algorithm for acute otitis media management, and second, we'll look at a viral symptom relief form specifically for pediatric patients. Both of these resources are available on the Antimicrobial Stewardship site on the Carilion intranet under the Ambulatory Treatment Guidelines. Here you'll find links to the acute otitis media algorithm and the viral symptom relief prescription, so choosing for adult or peds here. The acute otitis media algorithm helps walk through the decision-making process, which can be helpful for both clinicians as well as having a visual aid to show families why you're making the decisions that you're making. I'll bring each of these sections up a little larger for you to see. But here on the front page, it kind of walks through your decisions related to severity, patient age, whether this is a unilateral or bilateral infection, and emphasizes when to treat versus when you can consider observation and delayed prescribing. The back page contains several tables with more detailed information. The top portion addresses pain management, as of course this is a very painful type of infection, and diagnostic criteria for mild to moderate versus severe acute otitis media. The middle portion of the back page provides recommendations for first-line therapy for initial treatment, as well as options for treatment failure. And the last portion of the back page highlights 2 main target areas for improvement in prescribing, so that duration of therapy as well as delayed prescribing details and when you might consider this. An additional tool to help with delayed prescribing is the viral symptom relief prescription form. This tool may be used for several different viral infections, including if someone has a sore throat or a sinus infection or the flu on top of acute otitis media. So there are pre-filled selections to choose from that highlight the details for your specific patient, including how long symptoms can last, any pertinent instructions you might want to consider, and then medications for dosing with little fill in the blanks for patient-specific doses. So we all know acute otitis media is by far the most uncommon infection in children. So 23% of infants experience an episode before age 1. 60% of children have at least one episode before age 3. There are over 5 million cases occurring annually in children in the U.S., resulting in greater than 10 million antibiotic prescriptions. This is also linked to about 30 million visits to medical care providers, which results in direct and indirect costs in the billions. So all of these numbers are incredibly significant, and all of them indicate how important focused antimicrobial stewardship efforts are for this infection. So I hope you find these tools beneficial and start to incorporate into your practice if you haven't already. Our goal is always to improve care for our patients and our community by working together. Thank you.